If your period pain makes you miss school, work, or normal life, being told to just deal with it isn't an answer. Period cramps are common, but severe pain that repeatedly interferes with your daily life can be a sign of something more. One possibility is endometriosis. Endometriosis is a condition in which tissue similar to the lining of the uterus grows outside the uterus. And that misplaced tissue can cause inflammation, scarring, and pain. So, while painful periods can be common, debilitating period pain deserves medical attention. Severe period pain isn't something you simply have to endure. Imagine tissue behaving like your uterine lining, but growing where it absolutely shouldn't. That's essentially what happens in endometriosis. Endometriosis involves tissue similar to the uterine lining growing outside the uterus. It can occur around the ovaries, fallopian tubes, pelvic lining, and other nearby structures. This tissue responds to hormonal changes during the menstrual cycle that can trigger repeated inflammation and bleeding within the surrounding tissues. Over time, the inflammation can contribute to scar tissue and adhesions, and that's one reason endometriosis can become progressively painful. The problem isn't simply where the tissue is, it's how the surrounding body responds to it. The size of an endometriosis lesion doesn't necessarily tell you how much pain someone will feel. Here's why. Endometriosis can cause chronic inflammation in the pelvis. Inflammation can irritate surrounding tissues and nerves. Over time, repeated inflammation may also contribute to changes in how pain signals are processed. And adhesions can cause organs and tissues that normally move freely to become stuck together. That's why someone can experience severe cramps, pelvic pain, pain during sex, painful bowel movements, or pain outside their period. And importantly, pain severity doesn't always match what is visible on a scan. Endometriosis doesn't always announce itself with one obvious symptom. Some people experience severe menstrual cramps. Others may have chronic pelvic pain, very painful periods, pain during or after sex, painful bowel movements, pain with urination, heavy or abnormal bleeding, fatigue, or digestive symptoms. And some people may have relatively mild symptoms or even no obvious symptoms. That's part of what makes endometriosis difficult to recognize. Its symptoms can overlap with other conditions. So the important question isn't, does everyone with endometriosis have the same symptoms? They don't. It's, is this pattern of pain or symptoms affecting your life? Endometriosis can affect fertility, but having endometriosis does not automatically mean you can't have children. Endometriosis can affect fertility in several ways. Inflammation and scar tissue can alter the normal anatomy of the pelvis. Endometriosis can also affect the ovaries and fallopian tubes, and in some people, these changes can make conception more difficult. But fertility outcomes vary enormously. Some people with endometriosis conceive naturally. Others may need fertility treatment. So the diagnosis shouldn't be interpreted as, you can't have children. It's more accurate to say, endometriosis can reduce fertility for some people, but it doesn't eliminate the possibility of pregnancy. One of the most frustrating things about endometriosis, the symptoms can be real long before there's a diagnosis. There isn't always a simple test that immediately identifies endometriosis. Doctors usually consider the person's symptoms, medical history, and examination. Imaging such as ultrasound or MRI can sometimes help identify endometriosis, particularly certain forms of the disease. But not every lesion is visible on imaging. And symptoms can overlap with conditions such as irritable bowel syndrome, ovarian cysts, or other causes of pelvic pain. That can make diagnosis complicated. So, if severe or persistent symptoms continue, keeping track of your symptoms can help your doctor identify patterns. Your period shouldn't regularly stop you from living your life. Consider talking to a healthcare professional if you repeatedly experience severe menstrual pain. Pain that interferes with work, school, or daily activities. Pain during sex, pain with bowel movements or urination, persistent pelvic pain, or difficulty becoming pregnant. Don't assume that extreme pain is simply something you have to tolerate because you've had it for years. And don't compare your pain to someone else's. Your symptoms deserve to be taken seriously. Endometriosis isn't just a painful period. It's a biological condition that can affect pain, inflammation, organs, and sometimes fertility. Endometriosis isn't just a painful period, it's a biological condition that can affect pain, inflammation, organs, and sometimes fertility. Biology explains, compassion understand. Subscribe for more science backed stories.